So this is our community assessment windshield survey by Jeff, Chelsea, and Jacob. So we did this about Buffalo, New York. Now the physical environment and economics of Buffalo. So the economic is its lower socioeconomic status and is democratic. The neighborhoods that we did in our windshield survey are the major East Side and Broadway Village, Fillmore District of Buffalo Common Council. And the population estimates around 256,304 individuals. And for housing and zoning, all of the houses are old. They're about 100 years old. Residences, there's multi-family dwellings mostly, but there are some single-family houses. Median value of owner-occupied housing units from 2013 to 2017 was $77,800, and the median household income was $34,268. Signs of decay: there's a lot of disrepair, a lot of garbage and trash, numerous vacant lots due to demolition of vacant, abandoned homes that the city of Buffalo tore down over the past 25 years. Community core is mostly lower class. Mostly people were waiting for the bus, biking, or walking to get to their destination. Some homeless individuals pushing shopping carts. Ethnicity is mostly African American and Arabics within the bounds of our community survey. But there are residents from a variety of ethnic backgrounds. There are temples present for Islamic cultures, and there are Arabic restaurants. In Buffalo as a whole, African Americans represent 37.1% of the population, white is 47.6%, and Hispanic or Latino are 11.3%. Religion, there's many Catholic churches seen. Some churches that were found were Faith Chapel, Old Landmark Church, the Universal Church, Open Praise Full Gospel Baptist Church, Word of Life Community Church, Fillmore Community Church, St. Albert's Basilica, Victory Temple, Pentecostal Temple Church. Recreation, there's an area for children to play, although it's not very well maintained or very safe looking. And there is a community center, and everyone can use the community center, and it is open to the public. Common areas, there's churches, which are open to everyone. There is a small park, as seen in the photograph. There's Buffalo Science Museum, although we did not see any signs posted about anything.
In regards to the stores in the area, there are some small grocery stores, as evidenced by an Aldi's on Broadway. There's some retail stores, a laundromat, liquor stores, car repair shops, Rite Aids, pizzerias, gas stations, mini marts, bakeries, banks, and Broadway opticians. Residents in this neighborhood tend to travel to them by bike, bus, or car. While there is no major industry left in the east side of Buffalo, there is the Broadway Market, which does attract tourism during the holidays. Occupations in the area are primarily retail jobs, fast food jobs, mechanics, or restaurant-based service industry jobs. Transportation. Most people within the community tend to get around by bus, car, or bike. There is public transportation, as the Metro bus system does service a good portion of the community and appears to be used frequently. The streets and roads seem to be very run down, with numerous cracks and potholes seen. Safety. There is a fire station and police station within the district. While we did not see any police or fire trucks out in the community, and we only saw one ambulance en route, there is a Buffalo fire station at 2044 Bailey Avenue in Buffalo, and Buffalo Police District at 1345 Bailey Avenue. Communication. Residents in the community do have access to local newspapers, as seen, and local and national at stores like Rite Aid. There were numerous advertisements on the bus stop waiting areas. On the thruway, there are billboards which also provide advertisement within the area, and there is a post office within a 5-mile radius. Health and social services, there are schools, rehab centers, AMVETS, community health services, St. Vincent Health Center, and a urban center. Health services, there's 2 primary community health services within the community. They're the Jericho Road Community Health Center located at 1021 Broadway and the Erie County Health Mall located at 1500 Broadway. These are in addition to the Erie County Medical Center and the Buffalo General Hospital, which sits on the Buffalo Niagara Medical Campus, both of which are 2.2 miles from Response to Love Center. Health and morbidity. There was evidence of drug and alcohol abuse as we found numerous empty liquor bottles on the ground and even a needle laying on the ground near the sidewalks. Many residents were seen to be smoking while walking around or waiting at the bus stop, so that is another health problem that is seen in the community. Education. We noticed Academy School 44, the John E. B. Wiley Amateur Athletic Sports Pavilion, and an early childhood center, all within the radius which we assessed. Politics and government. Primarily in this region, it is the Democratic Party. There were multiple campaign signs in support of Mark Poloncarz for the county executive, and both the representative for the Erie County Legislature, the Honorable Howard Johnson, and the Buffalo City Council, Dave Franziak, are Democrats.
So we identified 3 weaknesses and 3 strengths. The weaknesses were disrepair, a lot of trash and garbage, which can lead to rats and spread of bacteria. Number 2 would be streets and sidewalks not maintained, which cause accidents and hazards for pedestrians. And number 3, bad health habits, which can lead to death and chronic health issues. Some of the strengths we seen was access to community health centers, numerous places for communications like churches, transportation within easy access like the metro, and public safety, and education options among all ages. The primary need that we identified was the need for education on health maintenance. This includes diet, activity, alcohol, and smoking. This is evident by the amount of smoking that was seen and the amount of liquor bottles found on the ground. This is also evident by the lack of accessibility to facilities for health maintenance, like primary care offices and to health information. Also, the population is interested in health maintenance, specifically about cholesterol management. Our nursing diagnosis is risk for ineffective self-health management related to a lack of knowledge in health management and limited resources for maintaining health in the community. We related this to the Healthy People 2020 with substance abuse. An indicator that is used is adolescents using alcohol or illicit drugs in the past 30 days was 14.2% in 2015, and the target goal for Healthy People 2020 was set at 12.8%. Our primary intervention would be to educate the population on health maintenance issues, educate population about diet, activity, alcohol, and smoking. Our secondary interventions would be to help prevent individuals from smoking, drinking, and eating unhealthy foods, educate on healthy alternatives, along with what community resources are available in regards to smoking cessation, addiction services, and access to healthy alternatives within the community. Our tertiary interventions would be to educate individuals who already have a diet, activity, alcohol, or smoking problem, and educate on how to reduce it, help individuals quit smoking, drinking alcohol, and eating unhealthy foods. And those are our references. Thank you.